Okay. So, as you understand, he has been infected with coronavirus. Secondly, to which he has developed a severe respiratory compromise. It has been an ongoing disease, and he's been sick for the last 15 days, I believe. Okay. Now the disease has progressed to a stage where he needs an invasive ventilation instead of a normal non-invasive ventilation. He has gone on to invasive ventilation. And secondary to invasive ventilation, his parameters or requirement of pressure supports for the invasive ventilation have gone up significantly for the last 2 to 3 days. So now, when we do blood gases on his this thing, so his gases show that he is not maintaining adequate oxygen levels and carbon dioxide levels, and he has developed some air leaks inside, minute air leaks because of barotrauma. So that's one thing. So they have given all kinds of medical treatment which will allow the lungs to heal. The lungs have had some disease process due to which there is inflammation. The function of the lungs have gone down, and we have given enough of medicines to allow them to recover. But unfortunately, the lungs have not recovered as expected. Okay. So now, if you want to move him anywhere else for further management, or if you want to continue further treatment, either he has to be prone, allow the lungs to rest, and then try to come down on the ventilatory parameters, which might be possible or might not be possible, as Dr. Sam has already explained, and he's been doing it for the last couple of days. And from his observations, he has observed that his parameters are going up rather than coming down. Okay, only when he's prone, the parameters are slightly coming down, not too much. Okay. So now the advantages of this ECMO, it is a machine which takes the blood from the patient and oxygenates it and returns it back to the heart. That is the function of this machine. Once this oxygenated blood goes inside, the heart uses it to pump it to the left side, and oxygenated blood keeps circulating in the body. This is the function of the machine. The advantage is he doesn't need to breathe for himself. We don't need to push oxygen and air at high pressures. And since the machine is working for oxygenating the blood, we can give rest to the lungs and allow the lungs to heal. And with this machine, we can move him to any place, either in an ambulance or in a air ambulance. Altitude doesn't matter. His requirements of ventilation on the ventilator comes down once he's on the machine.